Did you know that World War II veterans are now in their mid-80s and beyond? Many of these American heroes are now confronting life-limiting illnesses. About 1,800 U.S. veterans die every day, but only 4% of them will die in a VA medical center. The rest are cared for in the community. In 2009, the Department of Veterans Affairs Hospice and Palliative Care Program Office launched the Comprehensive End-of-Life Care Initiative. VA's goal is to ensure that seriously ill veterans from all generations and war eras have reliable access to quality hospice and palliative care in VA and in the community. This specialized support emphasizes comfort, the relief of pain and suffering, effective coping, and quality of life. Hospice and palliative care are part of every enrolled veteran's uniform benefits package. VA needs partners in the community to reach out to our veterans. Help is especially needed for those who are homeless, live in remote areas, or have never taken advantage of their VA benefits.
For some time now, the healthcare community has been evolving its thinking about end-of-life care, moving away from the sharp division between the labor of fighting a disease and, on the one hand, and comforting the dying on the other, toward a more integrative approach, a more holistic approach, combining curative or restorative care with palliative support from the early stages of illness. Now, as a major provider and purchaser of end-of-life care, VA has been evolving its thinking on this matter as well.
How does VA provide veteran-centered hospice and palliative care? It starts with knowing veterans and understanding their needs, including them in the process of developing their plans of care and coordinating their care across settings. Palliative care in VA is built around an interdisciplinary team of health professionals who assess the veteran's needs for symptom management and emotional support and help to clarify goals and priorities. Stationed at every VA medical center, the teams are often the veteran's first encounter with palliative care.
Pretty much everything we do in palliative care feeds off of the goals of the patient. What are their goals for care? Palliative care is not typically geared towards cure. It doesn't mean that it can't be given simultaneously to the pursuit of cure, but it is usually focused on comfort measures.
VA can provide palliative care simultaneously with more curative therapies. The palliative care team works with the primary health care team, focusing in on issues of comfort, pain relief, and care preferences.
So palliative care can be at any time the person is going through any life-limiting illness.
One of the goals that we have is to see patients earlier in their disease, really helping define what true palliative medicine is really addressing patients' care needs at the time of diagnosis and helping with whatever specific palliative concerns they need, whether it be pain management or anticipatory grief, and then following those patients a long time. We can be a source of continuity for patients that are often in a very complicated health system with lots of doctors giving opinions and lots of complicated decisions to be made. We could serve as an advocate for those patients.
Hospice is a specialized form of palliative care that is accessed when cure is unlikely. The focus of care shifts toward maximizing quality of life when its quantity might be limited. In VA, this shift does not require foregoing other medical treatments that may be desired by the patient and family.
I really think we have the model in VA of a term called open access hospice, that we're not denying or foregoing any interventions that are appropriate. We're just looking to match the goals and needs of the patient with the services that we have.
Most VA medical centers now have dedicated inpatient hospice and palliative care units, which are designed to be home-like and comfortable for both the patient and the family.
When they're coming to our unit, they say, "Welcome to our unit 7B. Now we're going to be your family too. And I want you feel that this is your home. And we try to make them laugh. We laugh with them. We will cry with them. And we create that bond with family and patient.
It's been so good for him. He was dying so horribly when he was home. I mean, he was in 4 hospitals back and forth and hooked up to all kinds of things here. I don't know what they're doing, but it's like a miracle. He's been really much, much better. And he can at least function and be a little happy, you know? And it's really like a miracle.
Trained volunteers with a commitment to supporting veterans offer an essential service.
And they extend our palliative care service by having the time and the care to spend with each veteran to understand the veteran's fears, to understand the veteran's goals, and then communicate that back to us. I think that's the single most important thing that they give us as a palliative care team.
We look at the men's pictures, we talk to them about their families so that they know somebody's there and can just spend time and do nothing but smile and hold their hand.
You'll never know, dear, how much I love you. Please don't take my sunshine away.
Because many veterans facing advanced illness would rather be in the familiar environment of their own homes, VA is committed to supporting that desire. Whenever possible, VA works with community hospice providers and other local agencies to help meet the patient's needs in the setting of his or her choice.
What's important to me is that I still am at home. I wish to stay here. And for as long as the good Lord lets me.
There's only so much hospice care we can provide in a VA hospital. That also needs to exist outside the hospital, mainly because it's their choice and it's close to home. And that's a whole lot more convenient for their family members.
So, of course, this effort is only meaningful if it improves care for veterans and their families. That's what the Secretary means when he talks about veteran-centric and results-oriented.
Throughout VA, measuring and improving the quality of care has become an essential part of its commitment to the veterans it serves. VA's Hospice and Palliative Care program has established the Promise Center to conduct quality surveys of bereaved family members. VA professionals use this voice of the veteran and family to continually improve the quality of their care.
Overall, how would you rate the care that your husband received in the last month of his life? Would you say?
Thankfully, those surveys show the worth of what you are doing. For example, ratings of excellent were 19 percentage points higher from families of veterans who received a palliative care consult compared to those who did not receive a consult.
Well, considering that the number of veterans that actually die in a facility, in a VA facility, are very low compared to the overall number of veteran deaths across the country, I think it's important that we disseminate what we're learning within our facilities to outside providers.
Providing targeted education and training to VA staff and their community partners is another way that VA promotes high-quality hospice and palliative care. VA has partnered with EPIC, ELNIC, and the Hospice and Palliative Nurses Association to develop veteran-specific end-of-life education.
Number one, there's some psychosocial issues. PTSD or post-traumatic stress disorder, traumatic brain injury, military sexual trauma, substance abuse. Each of those are not unique to veterans, but probably do have a higher prevalence and perhaps more importance near the end of life for veterans.
Military service represents a time of honor and camaraderie in the lives of veterans. But some veterans have also faced exposure to unique health risks or service-related traumas which can contribute to lifelong challenges, including post-service readjustment. VA wants to share what we have learned from caring for veterans at the end of life with our community partners and help them to meet the special needs of veterans.
The next cohort of veterans requiring end-of-life care, they're going to be a whole different culture than World War II veterans. The Vietnam military cultural experience was different than in World War II. So not only are the numbers huge, but the expertise that's required to care for these different culture of veterans, the different military era veterans, needs to change as our cohort of veterans we're serving changes.
We take it as our responsibility to make sure that the providers in the community, our hospice partners are aware of these needs, unique needs of our veterans. Because if you are going to miss that, you may be able to cure their pain, but not their suffering.
How does VA work with community caregivers to ensure that all veterans have access to high-quality palliative and hospice care? VA has partnered with the National Hospice and Palliative Care Organization and other groups to extend its capacity and outreach. A collaborative effort called the We Honor Veterans campaign is fostering the development of hospice veteran partnerships at the state and local levels. These connections give community agencies serving veterans the information and expertise they need to provide responsive, respectful care to veterans.
It's really what I'll call a four-step approach. As a community hospice program, you need to ask your patient, are you a vet? 2, you need to learn about how to deal with specific veteran end-of-life issues. So that's sharing our expertise. The third piece of this is engaging in a partnership with a VA. And that's really where I believe the dialogue needs to be focused. So there can be easy transition of veterans to and from VA and community. The last step in this piece is to have veteran-specific quality measures. We'll be able to compare end-of-life care across organizations. There'll be similar questions of quality in VA and in the community. And that is just a quality improvement project that I don't think can be surpassed in just about anywhere I know of.
When they see for themselves by very ceremonially delivering a certificate or pinning them, and the staff see how that patient responds, how the doors open for the stories that come forth, they see why this is so important.
Much of the collaboration between VA and its community partners happens at the regional or local level. VA palliative care champions and teams have developed relationships with community hospices and state organizations. One example is VISN 3, which was awarded the Circle of Life Award from the American Hospital Association.
What's going on in this room, actually, it is a great meeting of all of our palliative care consultation team members from each of our 9 VA medical centers within VISN 3. In addition to our palliative care team members, we actually have our regional HVP partners who are sitting in the tables with them. It's a work group meeting to discuss opportunities to promote education, quality, access to hospice and palliative care, and outreach to our veterans and our families.
We are so proud of our Hospice Veteran Partnership. Our goal, of course, is to make sure that all of the veterans in New York State are served by hospice and palliative care when they have a life-limiting illness.
There will always be little blips along the way where something doesn't go well, but we need to continually communicate and fix them before it becomes an issue for either the hospice or the medical center.
And we've been working together to make sure that there's a seamless system.
Some veterans, most in need of hospice and palliative care, may live in rural settings some distance from a VA facility, or they may have no place to call home. Connecting with these hard-to-reach, traditionally underserved veterans will require new ways of working with local hospices and other social service agencies.
40% of veterans are rural, and we need to reach out beyond the 153 medical centers, and that's where we have to work with our community partners to engage them, to know that when it's a veteran that they're caring for, there may be additional services and support the VA can provide as they provide that palliative care.
An outstanding example of an effective partnership between VA and a community hospice that serves rural and inner-city settings comes from Chattanooga, Tennessee. Hospice of Chattanooga has played an inspiring leadership role, convening the various community partners to coordinate their services for veterans. Hospice social worker Sherry Campbell explains how that collaboration came about.
About 20% nationwide of our homeless are veterans with honorable discharges. That's a huge percentage. So it was very important for us and the VA to reach out to the community kitchen and to the agencies, the shelters that might meet homeless veterans, and to make sure they know how to access those benefits. We found that most of the agencies in the community didn't really understand how to help a veteran access those benefits. We try and identify that veteran right on admission, whether or not they have been through the VA healthcare system. So we've learned how to complete the 1010EZ, that's the application for healthcare benefit. We help the veteran or his family gather that paperwork. Our VA clinic has been wonderful in acknowledging that this veteran is terminally ill. They've really worked hard to help that veteran that might not have been through the system before.
Our ability to communicate through our organizations and coalitions we form, eliminate a lot of time, a lot of red tape, and give us the opportunity to more successfully treat the needs of our veterans.
Before we might have seen the VA as an insurance or a payer source, but now we see them, and this is very important, we see them as a healthcare provider and partners. They might have had this veteran for 15 or 20 years coming in to see that VA doctor, and now we're caring for them at the end of life. It's important for us to keep that VA doctor posted on his care. They want to know.
It's all about relationships, and if you develop those relationships with the agencies in your coalition, then things are just going to go a lot smoother and work a lot better.